Good afternoon and thank you for your time. My name's Steve Rains-Greeno and I'm going to run through my project scoping presentation for unit number 9927. Today I'll run you through a background on both the company and product that's involved in the project, the project scope, goals and objectives of the project. We'll take a look at the timeline developed, the key elements of the project, the deliverables that we expect from this project, and of course a conclusion to end our presentation. So moving into the background, Mundipharma is a member of a global network of independent associated companies which are engaged in research, development, production and marketing of prescription medications and consumer healthcare products. It's said that 1 in 5 Australians live with chronic pain, and this figure unfortunately increases to 1 in 3 beyond the age of 65. Chronic pain that's not well managed can be exhausting and has real impact on quality of life for some sufferers. It really is a key area of focus for the government and for our healthcare system moving forward. Mundipharma has established itself as a leader in the development and provision of medicines for pain. And recently, to complement this division of the business, we acquired products that provide drug-free pain relief alternatives. The product's known as PainMate and is a discreet, wire-free, portable and affordable device that uses transcutaneous electrical nerve stimulation technology, also known as TENS, to provide fast, targeted relief. A picture of the product can be seen at the bottom in the bottom corner of this slide. The project scope. The scope of this project is to utilise the prescription sales force in New South Wales initially to raise awareness with the targeted GPs of the availability of an alternative or complementary drug-free treatment option for the patients suffering from chronic pain. Our representatives will be asked to discuss PainMate in the second line product slot after, of course, they've discussed the benefits of the company's prescription medications, which still very much remains the focus for the sales team. We'll provide a limited number of free samples to the top tier customers for trial, of course on request only. And this will be managed quite tightly by the PainMate product manager at head office. On approval, this product will look to begin immediately and will continue to run until the end of April 2020, which allows adequate time to assess market impact. The goals and objectives of this project. We're looking to raise awareness with general practitioners of the product's availability and benefits when treating patients with chronic pain. We want to provide GPs with a complementary treatment option to the patients that forms part of a multimodal treatment approach. We want to further reinforce Mundipharma as the leader in the pain market in Australia and really distinguish Mundipharma from its competitors in this space. And of course, one of the major goals of this project is to increase revenue for the business through the consumer goods channel. We'll now take a look at the timeline that we've currently got in place, which may be tweaked depending on unforeseeables that might happen as we begin this project and implement it. Firstly, we'll engage in ordering sampling stock. We will also then engage in organising, developing and printing of leave behind materials, so print materials that the GP sales force are able to leave if they're unsuccessful in seeing their targeted customer. We'll obviously announce the program to the GP sales force and get them ready, and in doing so ask them to closely look at their targeting, so that they can come up with a list of the key GPs that they feel will benefit from hearing the message around PainMate. We will engage with our training department to develop a training program so that the representatives are upskilled in the benefits and use of these products. We'll then engage in sales training, and we'd look to go live with promotion of the PainMate products at the start of October of this year, 2019. And that promotional period will run through till the 30th of April 2020. That's a 7-month period. However, we're really looking at 6 months because we need to take into or factor in that we're running over a Christmas New Year period with quite a lot of leave and doctors away. Throughout that whole period, we'll be implementing a monitoring and controlling process to ensure that the project remains on track. And then there'll be a close period towards the end of April to close the project off and report back our findings. The key elements. So looking at some of the risks that we've identified and the mitigation against those risks. Firstly, reps not introducing the product during their GP interactions. Now this is common when we don't have buy-in from the representatives or the representatives don't see any incentive for them to be talking about specific products. So we're going to implement an incentives program based on product calls to encourage reps to introduce and discuss the benefits of the products for their GP patients. And this will be monitored through the CRM system that the representatives record their activity on daily. We'll reward weekly in the form of an EFTPOS gift card to the top 3 performing reps. Hopefully instilling a sense of competition and drive for representatives to want to earn some extra incentives through a simple message on a very effective product. Another risk might be that we incorrectly target customers. So we need to review the target lists to coincide with the company's intel on prescribers with large numbers of chronic pain patients. And we'll alter those lists as appropriate. If this results in extension of the promotional period, we may look to do that also. Another risk might be that some of those GPs that receive free samples start to request more of them. However, what we're going to have is strict controls in place by the product manager at head office with allocated numbers being finalised and cut-offs put in place to minimise budget blowout for those who are requesting extra samples. And then another risk that we have foreseen is that retailers, the retail channels that supply the PainMate products for sale, for retail sale, may not have stock available for consumers to purchase after they've heard about it from their doctor. So we'll look to communicate the product promotion period to all pharmacies, which is the main channel of retail sales, via not only the reps that are taking part in this project in the New South Wales state, but also we'll utilise our key account managers of our current consumer health team to notify their customers that this promotion is taking place and to hopefully in turn expect an increase in sales of the product. Moving on to deliverables. So we're really looking to improve the access to the targeted general practitioners for the field force, which in turn will allow for a strong prescription medicine sales message. The prescription business is our major contributor to the company's profit, and we need to ensure that the prescription medications are still at the forefront of rep conversations. We want to reinforce that Mundipharma Australia is committed to the improvement of lives of patients suffering from chronic pain through a multimodal approach which aligns with key opinion leaders' advice in this area. And of course, ultimately, we're looking to increase sales of the PainMate device, resulting in an increased revenue for the consumer health division. Expectations of an increase in sales of $100,000 by the end of June 2020. So in conclusion, we're looking to utilise our prescription sales team to aid in the promotion of the newly acquired PainMate product to targeted GPs or general practitioners. We want to raise awareness of non-pharmaceutical treatment options for moderate to severe pain. And of course, we want to increase sales of PainMed product, resulting in improved revenue for the Consumer Health Division. Thank you for your time.